While thousands of lives are lost overseas, including those of native-born Saint Lucians in the diaspora, many at home on the 238 square Rock of Sages continue to show blithe disregard for public health safety. The authorities have beseeched Saint Lucians to stay at home, only venture out for essentials, and when doing so wear face masks, cover up and maintain a distance of 6 feet from your fellow countrymen. However, some have resorted living life with reckless abandon, recreating at the beach, visiting homes, congregating in the open, and thumbing their noses at the national quarantine and curfew. While most of the island's COVID-19 patients have thus suffered non-life-threatening symptoms, that might not always be the case in the future. COVID-19 patients can be afflicted by severe complications including respiratory ailments like acute respiratory distress syndrome, which requires the use of a ventilator. Host of HealthWise, president of the Medical and Dental Association, Dr. Merle Clark, reveals that the life-saving process of intubation is not for the faint at heart. Mechanical ventilation requires the insertion of a tube down a patient's throat via an endoscopic tool. It's called intubation, and it can be very invasive, requiring that a patient is sedated. The device lifts the epiglottis to make room for the tube that passes through the vocal cords to the lungs. The other end of the tube is connected to a ventilator.
Before you get on a ventilator, this has to be used to go down your throat, to then put a huge tube in your throat. And once that tube is in your throat, of course, nobody is allowed to see you in the ICU if you have COVID. A machine is breathing for you. You are completely dependent on others, so people have to be bathing you and seeing everything. And so much involved in an ICU, because we heard a lot of talk about ventilators, ventilators, ventilators. We don't want to have to put people on ventilators, and I can't. I mean, that's the purview of the anesthetist and the intensivist. So that's Dr. Simei Spencer and Dr. Becky Jean-Baptiste and General Alphonse, Dr. Cannon and the like. But ICU is not a nice place to be.
In COVID-19 hot zones in the US, there are examples of patients who have had to be sedated to perform the procedure, dying from complications and never getting a chance to say goodbye to their loved ones. Doctors and nurses give patients a chance to telephone loved ones before intubation.
But it's not a comfortable journey, so just remember that instrument next time you decide I'm going to go out or go to the beach or hide somebody who's coming in illegally. There is a lot. This could cause trauma to the throat area, and the tubes, of course, go into your lungs. So it is not a comfortable process. So Saint Lucians, beware of that and what it entails, quite apart, of course, from potential death. Thankfully, thank you, our patients so far have been doing quite well, and we're very grateful for that, but that is not any reason to let down our guard. We still have to be very, very cautious.
Intubation for mechanical ventilation can also put medical staff at risk because virus particles can squirt out of the lungs of a patient. Medical professionals report that some patients deteriorate so quickly that the ventilator is the only way to keep them alive. Hence, the best defense against the virus is to not get infected. Authorities recommend that you wash your hands, often with soap and water, for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your nose, eyes, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Most of all, keep your distance and wear a mask. So the next time you think it's a bright idea to head out to the beach for a day of fun in the sun, remember your life, the well-being of loved ones, and others are at stake. Colby DeVoe, HTS News Force.